Let's get started with Chapter 1, Certain Infectious and Parasitic Diseases. A00 through B99. These conditions can affect various body structures and can be considered full-body systemic or underlying conditions. It may require more than one code to satisfy medical necessity. In this section, there are many combination and multiply codes. Therefore, understanding how to sequence is most important. Sections in this chapter include diseases, human immunodeficiency virus infections, HIV, infectious agents, infections resistant to antibiotics, sepsis, severe sepsis, and septic shock, HIV infections, B20, HIV that includes AIDS. Code B20 can only be reported if HIV has been confirmed. Confirmed is when the test has been reviewed and initialed by a physician, and he or she has entered a diagnostic statement into the patient's medical record. Testing for HIV. When testing for HIV, use code Z21 for asymptomatic HIV status, which is HIV without the symptoms. For testing because there has been suspect contact with a carrier, code Z20.6. A different code, Z11.6, is used for screening, which does not mean there was exposure involved. For inconclusive test results, code R75. When you look up code R75 in the tabular section, there is an includes notation that states this inconclusive code also covers infants. HIV counseling can be used to code a return visit back to the physician to receive negative results, Z71.7. The 271.7 counseling code is used when HIV is discussed during any encounter with the doctor. Sequencing HIV. If a patient has HIV and a related condition such as pneumonia, sequence HIV first and pneumonia second, because HIV is the underlying condition of pneumonia, and pneumonia will be the manifestation. If a patient has HIV and a non-related condition such as a traumatic injury, sequence the injury first and HIV is second because a current HIV DX could affect the decision-making process for the physician. If a patient is pregnant and has HIV, one code is needed, 098.7, which is a combination code that means HIV complication of pregnancy. Infectious agents and infections resistant to antibiotics. Infectious agents. When an infectious agent is mentioned in another chapter without an organism, use codes from Chapter 1 to identify those organisms. Example, B95.0 is the code for streptococcus, which is an infection usually located in the skin or throat. B95.0 streptococcus, infections resistant to antibiotics. Whenever there is a known infection that is resistant to antibiotics, code in the Z16 category. The infection should be sequenced first and the drug resistance second. Z16. When coding sepsis, severe sepsis, and septic shock, the first DX is the underlying condition, or A41.9, which represents an unknown organism. According to the chart, there is a minimum of 2 codes used for severe sepsis. Septic shock cannot be a condition unless a patient has severe sepsis first. Septic shock may cause organ failure, and the organ failure is coded last. Review Chapter 1 Specific Coding Exercise.